If you're wondering how you can work as a registered doctor in the Middle East, welcome. Hello, my name is Ayush. I'm a second year medical student at Kazan State Medical University, Russia. In this video, I'll give you a complete breakdown on the guidelines to work as a registered doctor in Middle East. Stick to the end as it has few points to make your application butterly smooth. Section 1. Understanding the pathway. First, which Middle Eastern countries hire international doctors? For example, first UAE, but each Emirati has a different governing body. Second, Saudi, Qatar, Bahrain, Oman, Kuwait, etc. There is no single Middle Eastern license. Every country has their own governing body, but the process and the structure is very identical. For example, first, credential verification, second, licensing exam, third, job offer, and fourth, work visa and license activation. Once you understand it fully, it will be buttery smooth to apply. Let's start with the basic eligibility, the most important factor. Across Middle East, the conditions are same. First, a recognized MBBS or MD degree. Second, completed internship. Third, 1 to 2 years of experience after your internship. Saudi and Qatar are a bit strict on this part. Fourth, valid medical registration from your home country. And fifth, good standing certificate, not older than 6 months. Sorry for interruption, but as you can see, 90% of the viewers haven't subscribed yet, so please subscribe to the channel because it motivates me to make more content like this. So please subscribe. Okay, I won't disturb you, continue with the video. Section 2, document verification. This is the backbone. Every country mostly uses PSV, that is primary source verification, in which your degree, internship, experience letter or recognition or registration are verified directly from the source. For example, if Russian university gave you your degree, they will verify it with the university. So this process can take up to 1 to 3 months, but delays are also possible if incomplete hospital experience. Second, university delays. Third, incorrect dates or job title. Section 3, licensing exams. Almost all Middle Eastern countries require licensing exam except for few highly qualified specialists. Examples: UAE has DHA, DOP, etc. Saudi Arabia, SMLE, Qatar, QCHP exam, etc. Let me expand using Dubai as example. In UAE, there are 3 authorities. First, DAH for Dubai, DOH for Abu Dhabi, and MOHAP for other Emirates. Exam details. The exam type is MCQ. The number of questions varies from 100 to 150 and the exam time is 2 to 3 hours and you need at least 60% to pass the exam. The exam includes internal medicine, pedia, obs, gynae, surgery, emergency medicine, ethics and patient safety. And let me be very honest, these exams are not like Indian standard examination. So they are mostly based on clinical knowledge rather than pure theory or memory based. Section 4, job offering and visa. After you pass the exams, then you can apply for jobs. After you are selected by a hospital, the hospital will activate your license, sponsor your visa or work permit. You must note that your license is activated under the name of that hospital. Section 5, salary and benefits. Let's talk money. A general practitioner can earn anywhere between 8,000 to 15,000 dirhams or riyal per month. Second, if you are a specialist, you can earn anywhere between 18,000 to 35,000 dirhams per month. And if you are a super specialist or you are a consultant, you can earn above 30,000 dirhams per month. Benefits that are included. Often the accommodation is either subsidized or completely free. Health insurance, annual paid leave, and zero income tax. Section 6, common mistakes and best strategies. First, let's talk about mistakes. Mistake number 1, applying without enough experience, as Middle East demands experience. Fake or weak experience letter. Third, paying agents blindly. Remember, the Middle East rewards clean documentation and patience. Best strategy. If you did your MBBS from Russia, Georgia or the European Union, first finish your internship in India, obtain your license, work for 1 to 2 years in your home country, then you can apply for your registration. But yes, working as a registered doctor in the Middle East is absolutely possible, but only if you play the system smartly. If you want country-specific videos, for example, UAE versus Qatar, UAE versus Saudi, please let me know in the comment section. If you found this video helpful, please like, share it with your friends. Thank you so much for watching. See you in the next one. Jai Hind.